Hi, everyone. Welcome to Season 1, Episode 2 of our podcast. Today's podcast is about a very interesting doctorate project. We are talking to our pain app group, and they are spearheading a novel project type for our doctorate completion program, in which they're putting together an educational app. But first, let's take a quick introduction of everyone. All the participants tonight are both doctorate and pain fellowship students, so their involvement is on another level. So if you guys could just tell us a little bit about each member of your group and how your idea was formed.
Hello,
James, you want to start?
Yeah, I'm James Hilfiger. I work in Oklahoma. I live in Oklahoma City area, but I work out in rural Oklahoma. We started this project because we were assigned to it, but it's been very interesting. Just diving in to the aspects of chronic pain with shoulder. Next.
All right. How about Nikolai?
Yeah, hi, I'm Nikolai Mathewson. I also work in a rural community in the very tippy top of Northern California, about a half an hour from the Oregon border. I'm actually transitioning to doing chronic pain full-time, hopefully this next year. And yeah, so this has been a very interesting thing for me to look into. So thank you. Michael?
Yeah, so I've been a CRNA for 8 years. I graduated in Southern California at Kaiser Permanente, and I've done a lot of work with the SRNAs up here I'm in Northern Idaho, and decided to go back to my doctorate and this pain fellowship just to help me as a clinical preceptor for them. We're one of their main block rotations at the hospital where I work at now, and this has always been interesting to me. Before nursing, I was going to do physical therapy, and so this is sort of the bridge for me from anesthesia and that physical therapy of how to help people gain functional improvements in their life.
That's awesome. Jordan, how about you?
Yeah, I'm Jordan Scott. I was born and raised in Nashville, still live there. Went to MTSA the first time around and graduated in 2018. And I'm back again doing the acute pain fellowship and the doctorate completion, kind of in order to market myself, because I've transitioned to full-time locums. I'm doing a lot of work in rural communities, mostly in Texas and New Mexico. So to come in as a pain fellow and kind of have that as a little clout when I tell them that I can do their blocks, I can help them with a pain service, it kind of helps give me a little bit more edge to stand on. And it's been really interesting learning specifically about the chronic pain part of this.
Absolutely. Ileana?
Hello. I'm Ileana Izquierdo. I am currently in Southern California. I graduated from Inter-American University of Puerto Rico with my master's degree, and now I'm completing the dual program at MTSA.
Excellent. Well, it's great to have you all here. So let's start with the type of project you guys completed and the model you followed. James, can you tell us a little bit about that?
Yeah, so we created a chronic pain management app that helps patients with the knowledge to explore some non-surgical solutions to manage their chronic shoulder pain. It's helped revolutionize how patients can comprehend and manage chronic pain, and it simplifies medical information into accessible and user-friendly content. It uses videos and images to educate and engage users effectively, and it enhances awareness of treatment options. This app is expected to generate a significant demand for interventional pain management. Like our PICO question that we used to kind of guide us is in patients with chronic shoulder pain, are non-surgical interventional pain procedures effective in decreasing pain and improving quality of life? The methodology that we used the PICO framework, and we reviewed the pathophysiology and non-surgical intervention strategies for chronic shoulder pain using a systematic literature review of respected databases. This project's development phase created a patient-focused app and it aims to educate the public on non-surgical interventional pain options.
Well,
Let's
that
see.
sounds.
Oh, that's it.
Yeah. Oh, okay. That sounds like a really helpful app for that patient population. What's nice about the different models out there is the framework and the tools they provide to complete your EBP project. We took the initial step of forming the team by creating your group for you. So let's start out with how you search the literature. James, were there any terms or techniques that were especially helpful? And did you have to resort to beyond just a database search?
Well, the Prisma diagram shows our search strategy in a graphic form. A little over 1,000 articles were initially identified across various databases to be relevant to our research project. And we removed a bunch of duplicate results, and we were left with about 150 articles. Half of those were excluded, leaving 79 articles to be screened. After this initial screening, we were left with 38 articles to fully assess. 21 of those were excluded, leaving us with 17 studies that were included in the final manuscript. These studies were assessed using the Johns Hopkins Research Evidence Appraisal Tool and assigning levels of evidence from 1 to 5. All 5 of us appraised each study, and the results were collected and analyzed to determine inclusion. The summary of literature, search, and methodology. Our comprehensive literature search was conducted using CINAHL, COVID, and PubMed databases, and also a Gray Matters research. Additional references were screened for inclusion. The keywords were chronic pain, upper extremity, upper limb, shoulder, elbow, wrist pain management, radiofrequency ablation, platelet-rich plasma, corticosteroid injection, and pathophysiology. And then some other searches using a google.ca domain and clinical trials and gov.info search. These studies were filtered using the PICO question for relevance, and we included pretty much what I just said before: chronic pain, pathophys, et cetera, et cetera. These types of studies are random control trials, systematic reviews, meta-analysis of random control trials, randomized prospective comparative trials, concept reviews, and prospective cohort studies. And we use the time frame between 2010 to 2023. We excluded acute trauma or illness, animal studies, migraine, surgical interventions, opioids, opiates, narcotics, back pain, lower extremity pain, spine, trigeminal neuralgia, and the non-academic journal and publications dated prior to 2010.
Well, your search no doubt elicited a lot of content. Ileana, can you tell me, what did you guys decide to do with the information you found, and how did you come to this decision? Can you talk a little bit about your project design?
Hello. So our project, can you hear me?
Yeah.
Okay, perfect. So our project is about creating an easy-to-use app to help people with chronic shoulder pain using non-surgical treatments. Here's how we are designing it. We're using a simple language so everyone can understand it, even without medical background. The application have a clear, simple menu and easy to search. We'll use videos, pictures, animations to make complex medical information easy to understand. Also, we will provide information in a step-by-step way with quizzes, videos, and real-life examples to help users learn effectively. The table of content created in the app is very well organized and easy to use. The application will include success stories to inspire other users. We'll also have a forum where users can share their experiences and ask questions to healthcare providers. Also, users can track their pain levels. They can set goals and monitor their progress. This keeps them engaged and provide us with useful data for the future. We will keep the app updated with latest medical research, also listen to users' feedback to keep improving our application. We are also carefully planning the cost and timeliness for the project. We are working with experts as Michael, which is a member of our group, to make sure the application is engaging and easy to use. And before launching, the plan is to test the application with a diverse group of users to gather feedback and fix any issues. We'll make sure the information it's protected, and we will follow ethical guidelines, and data will be encrypted and kept confidential. Our application content is based on a thorough research from trusted sources, as James previously mentioned, ensuring it is accurate and up to date.
Well, it sounds like a lot of work went into that project design. It is very well thought out. So after planning this design for your app, what did you ultimately create after that?
So what exactly do we create? So we made a user-friendly application to give people the knowledge they need to explore non-surgical ways to manage their chronic shoulder pain. Our goal is to change how people understand and deal with chronic pain by making medical information easy and engaging. Our application turns complicated medical information into easy to understand content. We use, again, videos, images to teach users about their condition and the treatment options. By doing this, we hope to increase awareness and demand for effective pain management techniques. So after completing a thorough literature review using respected medical databases, we found a lot of information on treatments as the suprascapular nerve block, prolotherapy, platelet-rich plasma, pulse radiofrequency and radiofrequency ablation, and also the corticosteroid injections. And Michael, did you want to add a little bit about these treatments?
I'd love to. Thanks, Elena. All right. So I think the prolotherapy is probably the one that people have heard the least about. And what that involves is using normal saline or dextrose, so common solutions that are safe for the body. But if you place them in the right spot, they can elicit a little bit of an inflammatory reaction that leads the body to heal itself and create a stronger matrix. So if your tendon or is damaged, then it can help strengthen your tendon because it directs the cells of your body where to go to strengthen the area, and it gives your body a new way to manage the underlying condition that it maybe didn't have all of the cells there before that it needed. And so these non-surgical interventions, they've been around for a while. Similar thing with platelet-rich plasma, but instead of telling the cells where to go, you're taking the cells from one part of the body just with a blood draw and spinning out and getting the specific cells you need, and then injecting those cells that can help repair damaged tissue right at the spot of where your injury is. And then these were compared with steroid injections. That's probably been the most traditional approach to things, where you just inject steroids in the right space near where the pain is, except that won't last long. And so some of these, it helps for a while, but some of these newer therapies out there have the potential to provide long-term lasting relief.
Thank you, Michael. So this application just uses evidence-based practices to provide easy to understand information, aiming to improve users' pain management and overall quality of life. we are very excited about the potential impact of this app, and we are really looking forward to continued development and use.
I'm also looking forward to seeing how this rolls out. It sounds like a much needed service for a lot of people who may not want to or be able to undergo like the surgical option. So I think this is absolutely fantastic. So in the process of creating your app, did you guys have to survey any participants for any information? And if so, what ethical considerations or consent did you provide for the survey?
Well, we based our information that we provided on the latest evidence out there with our literature review. And our survey was really more for how do we make this readable for patients? Because as we've worked in anesthesia for a long time, some of these terms are more familiar to us, but might not be to someone who's not had that exposure. And so there are some tools out there. One of them is called the Patient Education Materials Assessment Tool, and it helps you review apps or audiovisual content or printed materials to determine, is this at an understandable level for someone without a medical background? And we sent those out, but we sent them out to experienced providers in chronic pain because we also wanted to get their feedback on what additional information we should add to our application, or what did they think from their experience in dealing with patients and explaining these things to patients, and just their professionalism of what could we do better, because they're probably going to be the ones that are interacting with those who use our app, because they're the ultimate people who will be able to provide that help and relief to patients seeking this care.
Absolutely. Was there anything on the survey findings that surprised you, or anything else you want to talk about?
So we sent it out to 20 CRNAs. We had a little bit of a low response rate, but most of them, I think it was a 15% survey response rate. We were hoping for more, but we got what we got. And one of them provided us with some feedback that was very helpful that I think Nikolai is going to touch on here in a minute. But we ultimately achieved our outcomes according to what they said of, yeah, this is an understandable way to present this material. This is similar to how I would try to present this material to my patients. It was easy flow. We didn't dive too deep into medical jargon. And if we did, we were able to explain what it was to help with their understanding. And so overall, the feedback that we've received from the content development for our application from these surveys is that we met our aims, and that from how they've read it, it should be understandable for the patients that they interact with on a reasonably frequent basis.
Absolutely. That sounds pretty helpful. Nikolai, so based on the feedback, did your group need to make any changes to your project?
Yeah, so touching on what Michael was saying, one of the respondents was kind enough to give us some feedback, not just, oh yes, it's understandable, it's digestible, and people can use this app easily, but kind of furthered it with some comments saying, hey, I think you should adjust some of these because the flow of the content would be better for learning. So while it's understandable, the organization could be better. So Michael did a nice job formatting that with his brother when they were putting this into the app format, and hopefully made the information seem to flow better, which was nice. And then the other feedback he gave us was, it's great that you made something people can understand, but he said that might not change somebody's ability to access something or make them responsible for their care. Like we've all, at certain points, we've all wanted to change or do something, but actually doing it is the hard part. So he said, what is the actionable questions? Because we originally had questions say, did this app help you? And it's like, yeah, information, everybody's going to say, oh, yeah, it's great. It looks beautiful. You can see our gorgeous little emblem in the back that Michael created. Looks fantastic. Sure, people want to say yes. But the more important question is, did they do anything? So that made us change our survey question to, what did you get help? Did you see a pain provider? What intervention did you have? And hopefully what we plan to do in the future is have interactive surveys on there with these questions, because then it can let people kind of know, one, was it helpful? Two, did you do something about it? And did that actually help you? So, I mean, that's going to be further down the line, but how we changed our project was just basically changing the flow of our information based on feedback, and then also changing some of our survey questions to know, did they do anything with this information, or was this just good for them to know and fun to play with? Because apps are fun. Everybody's got some Candy Crush on their phone. We all like that. But I think overall that was kind of the feedback, and those are the changes we made. Nothing too drastic, but definitely made us change our perspective of how do we make them more accountable and involved in their care.
Absolutely. And we live in the age of information overload. So I think having those action questions is a really, really good idea. And it just shows the power of having fresh eyes on your content, even just changing the flow. That small change is actually a huge change. So I think that's pretty remarkable. Thank you, Nikolai.
Of course.
All right. So let's move on to Jordan. What would you say is the biggest takeaway from your project?
So I think there are kind of two parts of our project in the way that we view it. There's the research portion, and then there's the app development portion. And our biggest takeaway from the research portion of our project was that there's overwhelming evidence to support that these interventional pain techniques that we've researched are effective and safe to treat chronic shoulder pain. But of course, every treatment is not going to be perfect for every patient. Depending on the etiology of the pain, the patient's presentation, the experts in pain management are going to have to evaluate each patient individually to determine the best fit for them. And then on the flip side, on the more hands-on side with the app development, the conclusion we found was that there's a lack of easy, accessible, comprehensive, patient-focused education material about the pathophysiology and the non-surgical management of chronic pain. So that's why we focused our energy on developing this app, because we noticed that there was a lack in that market and we wanted to fill that.
Absolutely. Absolutely. Where do you see your project going from here?
So on the research side of things, we noticed that there are some gaps in the research that we would hope to be filled, things that would be beneficial to investigate in the future. Specifically, there's some data comparing each of the treatment modalities for the management of chronic pain, but there's not a lot of that out there. So we'd love to see some more comparative studies comparing all of these treatments that we've talked about. That would help patients know which treatment they want to seek. It would help pain providers know which treatment would be good for each patient. There's also some limited research on the osteoporosis etiology of chronic shoulder pain. It is a common cause of chronic shoulder pain, but for whatever reason, it's not one of the most researched etiologies of chronic shoulder pain. So we'd love to see some more research come out on that. And there are some newer therapies like intra-articular ketorolac injections that they've only received limited coverage in the literature because they're so novel. So we'd love to see those topics addressed in future research. And then as far as the future of our chronic pain app, we have a lot of big dreams. So currently we have developed content specifically to chronic shoulder pain. And so while some of this content is relevant to all types of pain and all anatomical locations of pain, like we have a section on how to talk to your provider about your chronic pain, or conservative treatments of chronic pain like rest and ice and everything that you can start with to treat some chronic pain in all places of the body. We would love to someday incorporate specifics of the management of other common types of chronic pain into this same platform. Because we know that many patients suffer from chronic shoulder pain, but they're also suffering from chronic knee pain, chronic back pain, chronic hip pain. So we'd love to have some future information there to develop onto the same platform of the app. So our hope is that future cohorts at MTSA can contribute similar doctoral projects to ours to focus on different anatomical areas of the body. And then with each edition of each cohort's contributions, we can get closer and closer to the development of a real comprehensive resource for patients that teaches them about all types of chronic pain, all the available non-surgical treatments to manage it as well. And then on the technical level of this app, we're currently, as we said, we're in a kind of preliminary beta testing state. And we would love to, with some increased development in increased expertise in app development, and some increased funding, we could move it from its current beta testing state to a more fully functional interactive app that has all of those features that we've been talking about. And then finally, on the macro level, the future of, I guess, anesthesia practice. We hope that this chronic pain app could serve as a catalyst for future research and development for the fields of chronic pain education, the specific modalities of chronic pain treatment, the usage of technology in healthcare education, and then increased patient understanding of chronic pain, as well as an increased familiarity with the available interventional treatment options. That could lead to a higher demand for specialized pain providers. So an increased demand in those pain providers could lead to an increased expansion, advancement of more specialized CRNA pain practice fields. So these two things, come together. The patients have more understanding of what they could be asking for, leads to more demand for providers that can provide that. It's kind of this positive feedback loop that creates a snowball effect where there's an increased demand for specialized pain providers. There's an expansion of scope of practice of scope of practice for CRNAs. That leads to increased access to care to patients, and then they have better outcomes and improved quality of life.
Wow. You can't really argue with that, can you? It just kind of shows that this project is much bigger than just getting your doctorate. This project is more expansive than just earning your degree. It's not just a one and done project. It can really impact the field of nurse anesthesia, of anesthesia period, provide access to patient care. It's just kind of unbelievable, all the avenues that it can go down. And did you guys expect that when you started this project?
I don't think that was our expectation at all. You go ahead. We're all surprised by it.
I was going to say, I think it was hard to see, to know where we are now and to see that from the beginning. I think, it was a very difficult process because this was all very new to us. All of us have varying degrees of experience and a plethora of experience in different areas. So I think bringing 5 anesthesia providers from different backgrounds, it's hard to know, especially we live in all different parts of the U.S., how we're going to get this done. But I guess now being where we are, it seems like, this is just the beginning of something that could be so much bigger, which is very exciting. And it's kind of interesting to see all of our hard work. And luckily, one of our classmates and his brother knows how to do some coding. So, they brought the app to fruition. But without that, sometimes when you just have maybe 100 pages of content, it's hard to see how it's going to become something. So it's very cool where we are and where it's going to go, I think.
Absolutely. And especially when you're like in the very middle of your project and you don't know where it's going to go and you're like, is this worth it? It is such a difficult process. And unless you go through it, it's really hard to explain. But I remember telling you guys, I promise at the end of this, it's going to be worth it. You're going to look back. It's going to be completely different on the other end. So I think it's helpful for other EBP students or doctorate level students to hear that and hear, it's the process that earned you your doctorate. It's not just doing a literature review and publishing, mindless results. Anybody can really do that. But you guys have really pushed it past that level and have created an app, and you're paving the way for future students to help with this app as well and grow it. And I'm really excited to see where it goes. And I'm really, really impressed at all of your hard work. And I hope you guys are proud of the work that you've done, because this is phenomenal. So is there anything else you guys wanted to touch on or talk about, or anything else you wanted to say?
Just a big thank you to your guidance during this project. You helped us a lot as well.
Oh, thank you. That's so nice. Well, it was an honor to work with you all. And I can't say it enough. I'm really excited to see where this goes. I think you guys exceeded my expectations for sure, especially with the app. And I think you all did a phenomenal job. And thank you so much for talking today about your project. and I hope our listeners find it helpful. And it was just a pleasure working with you all. So thank you so much.